Welcome to In the Loop with Lupus in Color, where we strive to educate, inspire, encourage, and empower lupus warriors all around the world. Today's podcast is going to be about lupus and oral health. And I had the opportunity to speak with Dr. Mustafa, who is my dentist here in the Virginia area. It was a great conversation. I can't wait for you to hear what she has to say about oral health and lupus. So take a listen, and I hope that you get some great information and you get educated about oral health and enjoy the show. Podcast event, video, and lives disclaimer. The information or answers provided during Lupus in Color videos and live events are for educational purposes only. They are not meant to be used as a substitute for professional medical advice. The information contained in any video or live event is not intended to recommend the self-management of health problems or wellness. It is not intended to endorse or recommend any particular type of medical treatment. Should any attendee have any healthcare related questions, promptly call or consult your physician or healthcare provider. Persons accessing this information assume full responsibility for the use of the information and understand and agree that Lupus in Color or its presenters are not responsible or liable for any claim, loss, or damage arising from the use of the information.
Hi, my name is Mustafa. I am the owner and dentist here at Root Modern Dentistry in Ashland, Virginia, in the center of the universe. The type of patient experience I'm trying to establish is for patients to be excited, feeling comfortable, feeling less anxious and welcomed. I want the coming in through the door typically, instead of increasing anxiety, reduce anxiety, feel calm, feeling like they like to be here. I want patients to look forward to their visit with me. Patient comfort is one of the most important things I want to make sure that we're achieving. And in order to do so, I've incorporated a lot of things in this office when it comes to noise canceling headphones, earplugs, aromatherapy towels, things like a massage therapist on our team. Having these and many more opportunities for patients to reduce anxiety, feel comfortable, and feel at ease when they're in the chair. One of our top, if not our top priority here at Root Modern Dentistry, we take pride in serving dentistry in a comfortable environment. Technology over the years has improved dentistry. It's advanced the way that dentistry is delivered to the patient. Things like a CBCT, a 3D image. This can give us so much more information, and we're able to deliver better quality of care to the patient. At Root, we offer dentistry, general restorative dentistry, but we also offer advanced dentistry, things like Invisalign, TMJ therapy, sleep apnea therapy, smile makeovers, implants. At Root, we aim to offer a wide variety of dentistry to fit your certain needs. Your experience at Root Modern Dentistry is truly going to be a unique experience. I take so much pride in this office. It is everything I've ever wanted an office to be. From the aesthetic, the ambiance, the feel that you get in there, the smell that you smell, the music that we listen to here, the type of care you're getting, the treatment, the diagnostic. Everything in this office is everything I would want to be treated. So I have created an environment where if I were to go to a doctor, this is the experience I'd want to have. And I would be honored to be the selected provider to bring this customized treatment to you and change your experience of going to the dental office. I want to change dentistry.
Mustafa, how are you?
I'm good. How are you? Thanks for having me.
Oh, I'm so excited that you're here. I'm excited to talk about dental health with Lupus warriors.
Yes.
So why don't we start by you telling me a little bit about yourself and a little bit about Root Modern Dentistry.
Yeah. So I'm Mustafa. I own this office and I'm the dentist here. And when I've been in the dental field for about 5 years, working for private practice and corporate dentistry, and really never found the office that I, as a patient, would want to go to. I worked there, but I never really would want to go there, only because I wanted to get the going to the dentist energy,
right.
And I didn't get that. So I wanted to design a place that changes the smell of walking into a dental office, the feel of walking into the dental office. When you come into our waiting room, you don't feel like you're in a dental office. It just puts you at ease. It puts your mental health where it normally isn't at a dental office. And that helps me, the dentist, do what I'm doing much easier when I know my patient's comfortable. So simple things like this I wanted to introduce. So right when you come in, the ambiance of the office, and then when you get to the clinical floor, I've implemented technology that makes things easier, education for the patient. I mean,
Right.
And when patients understand what's going on, they're educated on what's going on.
Right.
It's easier for me to do my job, right? I don't sound like a salesperson telling you, hey, you need a crown. It's like, hey, you have a crack down your tooth. It can fracture into two pieces. Here's what it looks like. Here's what I see. Here's why I think we should do it. And that just really helps the patient. My patients, what I hear is, wow, I've never had an experience like this. I've never been told what I need, why I need it. I've just been told I need it. That just fuels my fire to keep doing what I'm doing. So yeah, that's Root, and I hope to introduce myself to more people.
Awesome. I'm excited because I found you. My husband actually found your dentistry by accident. So I was so excited to come and feel so comfortable with you.
Yes.
And talking to you, and you sat and you listened. So
yeah, and you
really
were one
important.
of those people. And exactly, I mean, we're a fee-for-service office, you know that, right? So that puts us at a higher tier.
Right.
And so we have to give our patients a reason to want to come here, right?
Absolutely.
We can't give the same experience that Dr. X or Dr. Y is giving because why would they come here? So I truly, I promise to uphold that experience from my first patient to my last patient. And hopefully this office will never close, but if it does, I don't expect, my patient experience will be the same across the board.
So let's get on with what happens with lupus warriors and how can lupus really affect oral health?
Yeah, so lupus requires you to be on certain medications, right? And it's what happens while you're on these medications happens to your mouth. So the first thing is aphthous ulcers, canker sores. These things can arise in the mouth, they're uncomfortable. Certain types of food makes it worse. So this is one thing. Another thing is long-term use of corticosteroids we know are shown to affect bone, right? And this can cause bone loss everywhere, including in the jaw. And in addition to that, if you have any periodontal disease or lack of oral health, it can accelerate this process. So you'll be more susceptible to periodontal disease because of the medication you're on. Joint pain with lupus, right? So you can have a lot of jaw pain associated with lupus. Xerostomia, dry mouth. We know this. This can affect, saliva is crucial in keeping the mouth clean. If you have dry mouth, you're more susceptible to getting decay. So these are, I mean, it can go on, but it's very important to have these conversations with your dentist and let them know, hey, this is what I'm going through. This is the medication I'm on, because we're not cookie cutter people, right? And even if I'm on the same drug that you're on, my response may be different to your response. So the communication with your patient, with your doctor is very important, and tell them, hey, these things are happening. Why? But yeah, I mean, joint pain is huge. Bone loss.
Absolutely. I love that you said the communication with your doctor, because I think sometimes we're afraid to communicate with our doctor as to what's going on.
And you don't want to overstep boundaries, right? As a patient, you don't know when you're talking too much or not talking enough. I always say this, and it's like the best advice I can give to anybody is just be your best advocate for yourself, right? There are clinicians out there that, because of the environment you're in, you're seeing so many people, sometimes you're not asking specific questions to that person. So at that point, just put yourself in that. It's important to tell your doctor everything about yourself. This is me. This is what makes me different from the other patient you just saw. How can we help focus on me? So yeah, being the best advocate for yourself and saying as much as you can. And you never know when you're going to run into that kind of doctor.
Yeah. Because sometimes it's so hard to communicate that because they are running. But that's what I like about your dentistry. That's because you take the time to really stop and listen and say, okay, wait, what's going on with you? You're checking blood pressure, you're making sure that everything is well before you even start the work. So that's important.
Exactly. And that's another benefit of being a fee-for-service office. This is the type of care I want to provide. I want to put my patient first. But in order to do so, in today's economy, I have to do it this way. So you get the patients that care about their health, right? They're not looking for the discount dentist. They're looking for somebody that helps them.
Absolutely.
And I have formulated that, and I stand behind everything I say and make sure every patient does not feel rushed out of my chair.
So, Dr. Mustafa, what specific dental hygiene practices can help lupus warriors manage dry mouth and other lupus-related oral issues?
Yeah, so dry mouth is huge and you want to combat it as much as you can. So there's a lot of things that can help with dry mouth. Number one is making saliva come, right? So you want to do some xylitol, xylitol chewing gum. I tried that, makes one. Another thing is stay hydrated. Drink as much water as you can. This is crucial. Another thing is, let's see, there's supplements that you can do that can, whether it's a spray or a mouth rinse, that can keep the mouth moist. If you have dry mouth, bacteria loves this, and so a lot of people have decay around the margins of their teeth that mimics. When we see it, we know, hey, this is from dry mouth. So it's really stay hydrated as much as you can and avoid things that dehydrate you. Avoid alcohol, avoid coffee. These things cause you to have dry mouth.
Oh, okay.
Yeah.
Well, I didn't know that.
Coffee. Exactly. Yep.
And then they tell you to drink coffee to help your heart.
I know.
It's like you have to play around.
I know. You gotta pick and choose your health points, but I mean, and you can drink coffee. Stay hydrated. Drink the water with it. So I mean, everything. There's a balance to everything in life. I know they tell you to drink a glass of red wine. I mean,
it's like every night I'm going to get a coffee and a red wine.
I know.
But I'm going to also drink some water.
Pick the advice you like more and keeps you happier. And just go with that.
Absolutely. It's definitely about balance and how you can balance it all out. Absolutely. So are the critical things with lupus, it seems to be decay because of the dry mouth.
Correct.
But we also have the issues with the bone and the nerves, and as you know, my mouth is crazy. Been through craziness.
Yeah.
But how do you suggest that they start to do the flossing and brushing and things like that? What helps with that?
So oral health is important for everybody. But like I said earlier, it's not a cookie cutter recipe, right? So one thing I want to get your mind into is who tells you to go to the dentist every 6 months? The insurance companies designed this. They told people to go every 6 months because they want to pay twice a year. Not everybody's the same, right? So if you have manual dexterity issues, you're going to have trouble flossing and brushing certain ways. If you have vision issues, you're going to have. If you have any underlying health conditions that make you more susceptible to bacteria pulling up in the mouth, you need care more. So you can communicate with your dentist and say, hey, maybe I need to come every 3 months. Hey, maybe I need to come 4 months. I mean, I have patients that say, hey, I try to floss, I try to brush, but I know I don't floss good. So instead of coming every 6 months, I'm going to come every 4 months. That way I'm at a peace of mind. I know that I'm doing my part, but I can also come a little bit sooner.
Absolutely.
So organizing a dental maintenance plan with your dentist that best suits you, that helps with your upkeep, right? You can have lupus, but you can have manual dexterity issues, right? So this is very important, is come up with a plan. Then at-home care. What percentage do you see your dentist in the year, and what percentage do you see yourself in a year, right? 5% you see the dentist, 95% it's you. That means it's your job to brush. Use an electric toothbrush. Manual will not work as well, okay? Flossing, make sure you're using proper flossing techniques. Make sure you're hugging the tooth, you're scraping the sides of the tooth because you don't have that saliva flow to get things moving, right? You want to manually and mechanically scrape the sides of the teeth. Use proper oral rinses, things that don't, alcohol-free ones that don't dry out the tissue more. Come up with your, hey, this is my armamentarium, this is what I'm going to use for my oral health, and this is how often I'm going to see my dentist, okay? And with a proper recipe, the best outcome forms. And keeping an eye on, okay, hey, I know I am on a corticosteroid, I know I have some bone loss, I know I'm grinding, let me see, so bone loss is, I'm more susceptible to it, let me make sure I am flossing. So that I don't feed into it. I don't let bacteria and an inflammatory reaction build up right there to accelerate the bone loss.
And that's very important, that whole create a plan and be on top of it. You know, keeping your symptoms at bay. And making sure that you're checking off the things during the day and tracking everything so that you know what to come and tell the doctor.
Exactly. And I think a lot of people just don't prioritize oral health as much as your general health, right? If you're diagnosed with diabetes, you say, okay, every 90 days I'm going to go get my blood drawn, I'm going to get my A1C results because I'm diabetic, I need this. But What about your oral health? You have underlying oral health conditions. Prioritize that. Get a plan for that. Go every 90 days, every 120 days, twice a year, whatever works for you. I mean, I see patients that I see twice a year. I'm like, oh, you can get away coming twice a year. You don't really need to come in here. But there's people that I see twice a year. I'm like, you need to be in here every month.
Just come and visit me.
Just come visit me. But it's how do you educate them to tell them this, right? So you show them, you educate them, but it's tough. It's tough as a dentist. We have it tough.
It's like, I want to tell you to come every month, but I know. But
there's a financial aspect associated with it. And that's where the patient education comes in. It's how can I give you the weapons at home to combat this.
I love that. I love that. That's important. So I want to thank you for coming, and I appreciate you allowing me to come into your office and get this information for my lupus warriors. If you can give one piece of advice to lupus warriors about dental care, what would it be?
My biggest advice is build a relationship and be your best advocate. And this is to your lupus warriors, but to anybody fighting anything. Battling or coping with anything, be your best advocate. Give over information to your provider. Let them know that your situation's different. This is what you're going through. Help me. Help me. Just ask for that help. And use your resources. You're not going through it alone. And to any lupus warrior, you're not going through it alone. There are other people that have xerostomia that don't have lupus, but you have that in common. Combine knowledge, combine brain power, educate each other. I know it's taboo, or you don't talk about your political views, you don't talk about your health underlying, like you don't put it, but it's okay to talk about your health. It's, hey, I'm suffering with this, you're suffering with this, what do you do that helps you? And that's my advice, is just know that you're not going through it alone. And be your best advocate, because at the end of the day, you know yourself more than any provider ever will.
That is awesome.
Yeah.
I love that. Be your best advocate.
Yeah.
And don't be afraid to speak up.
Exactly.
Yeah.
Exactly.
And you said overshare. I like that, because if you overshare, you're giving it all and then some. So you're not forgetting anything.
Right. You're not forgetting anything, and the more information you have, I mean, think about it from an investigator standpoint, right? If you have 2 bits of information, the world's your oyster of anything it could be. But the more information you have, the more it narrows it down to, okay, this is what this patient is dealing with. This is how we can focus on this plan for this patient. And I know this won't work because this patient doesn't have that. So the trial and error phase is a little bit minimized, and your time is less wasted, and our efforts go more focused on those what's more at hand. So overshare, give information about yourself. I know the dental office is you're vulnerable in this place. You're so uncomfortable. We're in your face. A lot of patients feel they're insecure. They don't want to see their teeth on the main screen. They're like, oh my gosh, that's what it looks like up close. But this is our field. We are dentists. This is our job. We are trained to look at your mouth and help you how we can help you. And I use this example all the time. When I was younger, going to the dentist or eye doctor, I would always spend time on like fixing my hair, fixing my eyebrows, making sure, oh my gosh, the dentist, I don't want them to see any excess like stuff. They're looking at me. And now, being at the other end of the chair, I don't even know if somebody got their eyebrows done or not done. I'll do an extra oral exam. But if your eyebrows are not plucked, I don't care. I'm trying to do what I need to do. And I wish I would have told that to the 15-year-old me. Like, don't waste your time.
Hindsight is 2020,
right? It's uncomfortable, but it's okay to be uncomfortable. Give more information, be your best advocate, and use resources. You're not alone.
Awesome. Thank you so much.
Absolutely.
I've had such a plum-pleasing pleasure talking to you as always.
Thank you.
And hopefully we can do this again soon.
Yes, likewise. Thank you for having me.
Not a problem.
Wow, that was a wealth of information. I am so thankful to Dr. Mustafa of Root Modern Dentistry for helping us out with learning about our oral health and lupus. If you have any further questions, you can ask them below in the comments. But if you are in the Richmond, Virginia area, please make sure you check out Root Modern Dentistry for all of your dental needs. We are so excited that we were able to bring you this information, and I hope that you enjoyed it, and I hope you have a great day. Bye.